Good morning, GBMC Vein Center. This is Crystal speaking. How may I help you?
Every day is pretty busy here. This morning we saw a patient who had a clotting disorder and had multiple blood clots in his leg, and he was concerned that he might be developing a new clot and whether or not possibly surgery would be indicated. We also saw a woman who recently finished her pregnancy, and pregnancy is one of the known risk factors for developing vein disease, and she was concerned because she was noticing more prominent varicosities in her legs. Yep, thank you. And that's what's very exciting about dealing with venous disease, because we get to see a very diverse spectrum of patients of all ages, ranging from their teens all the way to their 90s. Just because someone has venous disease doesn't necessarily mean they need any kind of surgical intervention. So a lot of times when people come in, first I need to make a determination about whether or not their symptoms and the signs that they're presenting with are due to veins or if they're due to another type of disorder. So commonly we'll see people with other kinds of problems. Get the duplex here on the operated leg. The beauty of the Vein Center at GBMC is that we have all of the diagnostic resources here available to our patients, and so I'm able to, in real time, take a look at the ultrasound and make a determination about whether or not we need more information on the ultrasound or whether the patient needs definitive surgical care or continued medical management. All right, is this our next one? Yeah. I'm very privileged to be working with such a great team. Two of the staff members here have actually, I've been working with them now for several years. And it's really important to not just come into an office. This is really, my second family here. And it's important to make everyone realize that we really are part of a team, that no one is the leader, it's not hierarchy, and that everyone has a really essential role. And without them, this wouldn't work well. It's very exciting for me to have seen Crystal and worked with her now for a couple of years, to see her really evolve and grow and expand her role, and I see great things from her.
Well, I look at it as if I was a patient and what I would want from my doctor's office. Yeah, I felt like it was important to everything that you do. I feel like it should be up one step above what you were doing previously. So just bettering yourself and just taking an extra step up.
We have a beautiful office here. I'm lucky, but I also have the added benefit of being very close to Cassandra when she's taking vitals on patients, and so it gives me great joy to hear her speaking with them in such a warm fashion and hearing them laugh and have her really interact with patients so that they feel comfortable with her as well. I feel that we offer the kind of attention to detail that is necessary even with small procedures. I want patients to really feel that they're here, they're being competently and comprehensively assessed the minute they walk in, and that we're here for them, because that's really what it's all about.